Good morning, Mr. Chair, Commissioners. I handed out our trends of cases just in the last weeks, and as you see, our cases continue to increase, which we expect. That's not alarming to us because we continue to do testing, so we're going to see more additional cases. What we really look at is number of deaths, which is unfortunate. We see a few additional deaths, and every death is important, so we don't want to make light of the low numbers, but we have 29 deaths as of June 1st. Also, we're looking at, as I look at the Minnesota, we look at hospitalizations and deaths in Minnesota and of course in our metro area. And in Minnesota, ICU beds are a little over 1,000 used for COVID cases. Their capacity is 1,257. Now, this is across the state of Minnesota, so it's all hospitals. And they can ramp up about 700 more within 24 hours. So we aren't at capacity there for ICU beds. Ventilators, there's 597 that are on ventilators for COVID. And the capacity across the state of Minnesota is 1,433. So we're well below those numbers on ventilators. Sanford has about 20 to 30 ICU beds with an ability to ramp up more than that, but about a third of those as of last week were used for COVID. So the numbers aren't ramping up for them. They're able to manage that with just the beds they have. And Essentia had just 3 ICU beds used for COVID. So those numbers, they're not seeing huge ramps for those. So that's the good news. So we watch that. We meet with Sanford and Essentia remotely every week just to discuss cases and what's happening in our community, as well as the other healthcare officials. Family Healthcare has a downtown testing site. I think I mentioned it last week, and they continued that this week. They expanded it one more week. And that testing site is for those populations that use family health care. It's also for vulnerable populations, so anyone that's experiencing homelessness. So we did have a few, we assisted them with transporting clients that had no means to get over there and trying not to have them use the public buses. So we transported a number of patients or a number of clients over there. I can't remember the number of how many there were, but we did a number of clients. A person from my staff did the transporting. So we were able to get some more testing done for some of the homeless population. So that was good. Let's see, any questions on the cases or the chart? Sanford and Essentia are still doing their drive-through testing as well, and those have to go through their healthcare system, so it's not an open mass drive-through. They check with their healthcare provider or the nurse, call nurse to see if they meet the requirements. It's those that are symptomatic and those that think they had a contact with a positive case. So they screen those through the healthcare providers, and then they can do those drive-through testing at Sanford and Essentia. We don't have any mass testing in those two areas.
I have a question. Are any of the patients currently at Sanford or Essentia in the metro here on ventilators?
We don't have that information, and they weren't able to give us that. Okay. We requested it, but they're not able to give us that information. So.
Thank you.
Mm-hmm.
Kathy, can you explain to me why we don't have the data for no longer needing isolation?
They're just slow in getting that information to us.
So they're still tracking that?
They're still tracking that, right. Right. Yep, it's just not been available. They're a little slow in getting that documented. And then I handed out, sometimes we get questions about the symptoms, and so I handed out the very colorful sheet. Is it COVID or is it other things? So it can, there's COVID, and then there's the flu or influenza, and then there's your just a basic cold symptoms, and then allergies. So you can see, cough and fever are mainly what you see with COVID. It's the same with the flu. and not so much with colds and allergies. I've had questions about, I have a runny nose and sneezing, should I be worried? Well, as you can see, that's rarely a symptom with COVID. And it's often a symptom with allergies or cold. So much of the respiratory stuff is going on, and people get concerned right away. I must have COVID-19. And so some of the symptoms are clearly the cough and fever are the two primary, but you can get the body aches, headache, fatigue, sore throat, loss of taste and smell. And sometimes those happens, but the primary is the cough and fever. So at least it distinguishes a little bit between, we can provide information to people whether it's really just an allergy or a cold. So that just kind of gives you a little snapshot of that information.
I saw you got about 13 different things listed there. You could put another column on their old age and it would cover all of them too.
We'll add that.
I was just wondering, I mean, what are you supposed to have, one of them or two of them? Are you concerned about,
Well-
how many should you have before you get concerned about this? I mean, when you talk shortness of breath, well, okay, I got that, headache, daily, whatever, I don't know. But, I mean, how many of these you need? Or
They initially put out cough and fever and two of the other symptoms, but then they eliminated the two of the other symptoms. So, the big thing is if you have a fever, that's primary.
Okay.
And then if you have any respiratory, the cough, the shortness of breath, sore throat, we've heard of that a lot. Lost in taste and smell, sometimes that's part of that symptom. So, it can mimic others, as you can see. So we really, sometimes the fever is the primary, where stay home and let's just see if you have reduced the fever, because not every fever means you have COVID either. So it's a challenge. There's other screening questions, but we really primarily look at cough and fever for people to stay out of work.
I got one more. Kathy, did you see that Catalyst Medical in Fargo is offering antibody testing?
I did see
To the
that.
public,
I haven't contacted them to see what that entails, but I did read about that.
Yeah.
Yeah. Okay, I'll turn it over to Cheryl and then Jamie to provide more information on things that we're doing.
Good morning. So what I'm going to talk about today is basically the testing with long-term care and assisted living. At last week's board meeting, Kathy had mentioned that had begun with coordination between the National Guard and Minnesota Department of Health. So that started on May 17th. We right now have 3 facilities that are have undergone their 3 rounds of testing. So they do a baseline, and then a week later the second round, and then a week later the third round. So we have more testing that's taking place this week. We have 3 more facilities that are being done this week. Part of my role has been to serve as a liaison for local public health between the Minnesota Department of Health, the National Guard, and also the facility, which usually entails that I'm doing frequent communication with the facility, finding out what the needs are of the National Guard to try and provide a smooth event for their testing of residents and staff. And so far that has gone quite well. They have Minnesota Department of Health has set up couriers to pick up the samples. Some of those samples have been going to the Mayo Lab. So the courier drops off a container because the samples need to be placed on ice and kept that way, and then they pick them up after the event to transport them to Mayo Clinic. Also wanted to mention that beginning this past week, last Tuesday I believe, is there are 3 static sites over on the North Dakota side in Fargo and West Fargo. That is coordination between the North Dakota Department of Health, National Guard, and then Fargo Cass Public Health. And they set that up to basically do businesses on their side if there are businesses that have employees that need to be tested. For us, they're allowing us to send over staff people from some of our healthcare facilities, our adult corporate foster care units, and they basically complete a form where they can pick a 2-hour time slot on a particular day of the week so that they can go over there and then there isn't a line for them to stand in. These sites over on the North Dakota side are not for mass testing. They are for specific criteria. So that allows another option for people on this side of the river that are healthcare workers in a facility, or if there are businesses that wanted to participate as well, that they have another option for testing.
What was the results from last weekend's testing? Did we get any results from that?
There's 9 positive out of, I think there was 810 that were tested. So very low positive rate.
Okay, thank you.
Any other questions? Thank you.
And Jamie. There's Caitlin.
Good morning. I
Morning,
just want to
Jane.
take a minute to tell you about an opportunity we had last week to work with the nonprofit leaders in our community to provide some educational resources to the non-English speaking community members. And so as a part of the Red River Task Force that we have been participating in virtually each week, we have a subgroup that is focusing on unified messaging and utilizing local leaders in order to get the messaging to the community that we need in all ways. But we were contacted by the Afro-American Development Association, and they had received a grant from Concordia, and so the grant was allowing them to do some video messaging. Our non-English speaking citizens in the community often will use internet and local leaders to get the information they need, but the challenge in any disaster is to get what's going on locally. So we were excited, they reached out to us. There was a Somali TV that came out from Minneapolis, and we provided a video. Cheryl was the star of the video, and we were able to tell them what's going on in the community locally. And so the information we shared was about how things are being done in Minnesota for testing, the contact investigation, the contact tracing, and also just to repeat the information of the hygiene and social distancing and wearing a mask. And so it was fun, and it was an exciting opportunity for us and a connection that we were able to make with this organization. Of course, the grant from Concordia helped them to provide the resources for the community, but also to get the Somali TV. So the recording will be actually translated into Somali, Sudanese, and Kurdish languages and broadcast. And so I want to also take a minute to thank Hakun Dabar and Kani Adim, 2 leaders that we worked with last week on Thursday, and look forward to working with them in the future.
Okay,
Okay, any questions for us?
I'm okay. Anybody got anything? All right, thank you for the update then.
Thank you.
Thank you.
Good.